We actually started Illumination Foundation dealing with families with small children. At the time when we started, that was all we knew. Looking back, we realized how difficult that was. So now instead of dealing with one individual, you have 4 to 5 different set of problems that you need to address to consistently keep them, for number one, get them in housing, number 2, keep them in housing. We realized that we started with the hardest population to deal with and with families which have unique problems. The converse side of that is that residents and citizens have a soft heart for children. So a lot of individuals say that, well, we're not too concerned about the adults, but we worry about the children. The benefit is that sometimes the children are the point that you can convince somebody to really care about. Once they meet the parents and they realize, we need to care about the whole family. We never understood about trauma and trauma caused to children that were homeless. It is well documented now in many studies that show that children who are traumatized by being homeless and all the adjunctive issues that happen to them, all the other traumas as a result of being unstably housed, actually changes the brain waves in their brain and will condition them to not only have health disparities, but have mental health trauma issues as they grow. We refocused our efforts about 5 years ago and started concentrating on children that were unstably housed. And we do a preschool and an after school. In both these programs, we address trauma. And we work with children, number 1, to give them a safe place to stay, and number 2, to continue educating them on what is a healthy lifestyle, whatever that might be in their situation. So in the last 2 or 3 years, we've seen incredible advancements with children that now are leading so-called normal lives, but they're starting to be able to compete in the classroom. They're starting to become more healthy individuals, and they now have a great chance to be a normal, thriving adult. The reason why we're really successful working with families is when we first started, we realized that there was some gaps in services. One of the critical gaps in services in Orange County is that a family with a male child over the age of 10, there could not be sheltered with the rest of the family. We looked at a family as who you're with and who you're staying with is your family. So we prided ourselves on taking complete families, even families that were as large as 10 in a family. We found room and took them into our program.